Good afternoon, everyone. My name is Tatiana Lin, and I am a Senior Analyst and Strategy Team Leader at the Kansas Health Institute. Kansas Health Institute is a nonprofit, nonpartisan health policy and research organization based in Topeka, Kansas. And today we are very glad to welcome you as we are featuring a webinar, How to Follow IRS Lobbying Regulations in Health Impact Assessments and HI Program Activities. As all of you are aware, all health impact project grants include a restriction on lobbying, but understanding what constitutes lobbying is often complicated. We are very glad that you were able to join us today and learn how you can effectively engage with policymakers without violating your grant restrictions. This presentation will feature a few examples of local and state HIAs and offer you an opportunity to answer questions. I am very pleased today to welcome Alan Matheson, and he's a lawyer for nonprofit organizations. Alan helps nonprofits with everything from their initial incorporation and getting their tax exemption to dealing with employee matters and vendor contracts. But Alan's passion is in helping nonprofits understand how they can influence policy, teaching nonprofit leaders the rules regarding lobbying, dispelling myths about what they can and cannot do with restricted grant funds on legislation and related to elections, and helping them to plan strategically to change public policy. Please welcome with me Alan, and we really want this presentation to make interactive. You'll have an opportunity to ask questions. We'll have a chat box for you available later on, so please write down your questions, and we look forward to hearing your thoughts and feedback.
Thanks, Tatiana. This is Alan Madison. I wanted to go over briefly, just explain what our goal is today. Today we're going to cover the issue of what is lobbying. As you know, the grant restrictions say that you're not allowed to conduct any lobbying, but we want to understand exactly what is lobbying so that we can be as effective as possible with our health impact assessment, so that we can get right up to the line of making sure that we understand what is lobbying and, more importantly, what isn't lobbying, so that we can help to educate policymakers without crossing that line. And then we're going to apply the theory to some real-world situations later on in the discussion so that we can make this a little bit more interactive. We'll be asking questions and hoping that the participants, hoping that you all will share your thoughts about whether particular situations are lobbying or not lobbying, and ways that a hypothetical organization could restructure some of their activities to be able to explain as effectively as possible the conclusions that they've found in their health impact assessment. Briefly, a little bit about my background. My background is I came out of the nonprofit world and came out of the political world to become a lawyer who specializes in helping nonprofits. I love to help nonprofits maximize their advocacy because too often we find that nonprofits don't go all the way up to the line. People don't know where that line is between lobbying and non-lobbying, so they stay far behind the line, which frustrates the organizations and frustrates the policymakers you're trying to influence, and it frustrates your funders who want you to be able to use all of their grant funds to the maximum extent possible. One common myth is that Section 501c3 public charities cannot lobby, and that's, of course, just a myth. C3 public charities, which include most universities, most advocacy organizations, and most public health organizations, they can lobby. There are some restrictions on how much lobbying they can do, but that is, and there are also restrictions on private foundations funding the activities of those public charities. So most of your organizations, and especially everything that's coming out of the Health Impact Project, funds may have originated with a private foundation, 501c3. And a private foundation is a different type of 501c3 organization. They may not directly pay for lobbying. So a private foundation could give a general support grant to an organization that says, here's money, go do anything you want with it. And the organization could use that for lobbying. But what happens more frequently is that private foundations give project-specific grants. For example, all of these health impact project grants are specific to your project. And those grants usually have a restriction that says you may not conduct any lobbying with this grant funding. So it's important for us to understand what is lobbying so we can understand what we can and can't do. This presentation only involves the IRS rules. It only involves those restrictions that are applied to the grant funding from the foundation. There are federal and state lobbying laws as well. In each of your state capitals, you may need to register or report to a state ethics board. It's important for you to check for local compliance about making sure that you're complying with those laws. The Lobbying Disclosure Act regulates congressional lobbying, and information there is available from the Secretary of the Senate and the Clerk of the House of Representatives. And state laws are usually found on the State Ethics Board or the website of your Secretary of State. And I've included a URL here for a place where you guys can find information about your state laws. But it's important to consult a lawyer who's experienced in these issues to make sure that you are registering and reporting properly. So what is lobbying? Frequently in the sort of common vernacular, people talk about advocacy or lobbying for nonprofits, and they confuse the two terms. Advocacy is a general term, meaning any kind of act or process supporting a cause. It's not specific, and for our purposes, the term advocacy has no meaning, because advocacy can include both efforts to educate the public that are purely educational and not lobbying, but they're advocacy that will try to change the culture of public health. Lobbying, though, is a very specific term. Lobbying means efforts to influence legislation, and the Internal Revenue Code, Section 501c3, has very specific definitions about what lobbying is. There are two different ways to define lobbying. There's the insubstantial part test, which is very vague, and there's also the expenditure test. And we're going to talk today about the expenditure test because that's the test that foundations use when they are restricting your grants from being used for any lobbying. So the Health Impact Project restrictions, for example, use this very clear expenditure test definition of what is lobbying. The expenditure test defines two types of lobbying. There's direct lobbying, which are communications directly with lawmakers, and there's also grassroots lobbying, which are communications with the public to influence lawmakers. So direct lobbying has three elements. It's a communication directly with a legislator or staff member on specific legislation, and it reflects the organization's view on that legislation. So we'll walk through all three of these elements. But keep in mind that if you're having a communication that leaves off any one of these three prongs, then that activity is not direct lobbying. So a communication directly with a legislator or staff member that's not about specific legislation will not be direct lobbying. So the first prong is a communication directly with legislators or staff. This could be a face-to-face meeting, it can be emails, it can be phone calls. It is not, what it isn't, are public communications. So for example, if you know that Senator Claire McCaskill drives down I-70 on her way to and from the airport whenever she's flying in or out of Washington, and you put a billboard on I-70 that says, Senator McCaskill, vote for SB 296 to support Missouri's children. That's not direct lobbying, because that's not a communication directly with a legislator or staff member. Again, direct lobbying is only these types of direct communications with legislators or staff members. It also covers certain executive branch officials or staff members. It covers communications with executive branch officials only to the extent that you're talking to them about specific legislation that they are in the process of formulating. So if you're talking to the aide to a governor about a budget proposal that the governor is about to submit, and that aide to the governor is part of the budget proposal team, that could fall into the direct lobbying realm. But for the most part, your communications with executive branch agency members are not going to be considered direct lobbying. So there's a huge amount of executive branch and regulatory action that you can influence without it being considered a direct lobbying. So any legislative body is included in this, everything from Congress all the way down to town meetings. But again, as I said, it excludes administrative agencies and, importantly, zoning boards and school boards. So again, direct lobbying is a communication directly with legislators or their staff on specific legislation. That includes bills that have been introduced. It also includes specific legislative proposals that haven't been introduced yet, but that you're speaking with them about, you're speaking about those proposals with such clarity that it's clear to the legislator or the staff member what it is you want them to introduce. For example, if you tell legislators, New Jersey should introduce Pennsylvania's Healthy Food Financing Initiative, those New Jersey legislators would understand exactly what bill from Pennsylvania they would have to import into New Jersey to adopt it. Or if you said Michigan should adopt California's clean air standards, the Michigan legislators would know precisely what proposal you're talking about. If you talk generally about a policy, though, and just say Michigan should adopt policies for cleaner air, that wouldn't be a specific legislative proposal because you're not talking about it yet with enough clarity that the legislator would know what to introduce. I also want to flag here that the ballot measures, the voters are the legislators. So any communication to voters with regard to a ballot measure would be a communication directly with the legislator about specific legislation. So public communications about ballot measures count as direct lobbying. So it's a communication to a legislator on specific legislation, but keep in mind that means you could talk about regulatory actions, executive actions, a whole host of corporate actions or other institutional actions. For example, if there were, if a university were going to take an action, or if there's a private developer who's thinking about building in a particular area, and you were looking at the health impact that that would have, that's not related to any sort of specific legislation. So there's no limit to the extent to which you could communicate with legislators about that proposed action. So just to recap, it's a communication directly with the legislator or staff member on specific legislation, and the communication has to reflect a view on the legislation in order for that communication to be direct lobbying. Now, it's very rare that a communication to a legislator is going to hide the organization's viewpoint. The communication may reflect a view without explicitly supporting or opposing the legislation. Very often, groups in the public health field feel that they're talking to legislators without reflecting a view on the organization's viewpoint. From the perspective of the organization, they're simply providing educational information to the legislators about the impact that a proposed piece of legislation might have. For example, the legislation might increase the rate of car accidents. The legislation might increase the rate of teen drinking, and legislation may result in fewer people having health insurance. The organization might say, well, look, we're not endorsing the legislation. We're just saying what the impact of that legislation will be. The way that the rules are written, reflecting a view on the legislation includes talking about what the impacts of that legislation would be. So it may very well be that the discussions you're having with legislators about your health impact assessments may be considered direct lobbying. It's something that we need to think about, and we're going to talk about some specific examples of that later on in this presentation. That was direct lobbying. Direct lobbying, again, was a communication directly with a legislator or staff member regarding specific legislation. Grassroots lobbying is the other type of lobbying. And grassroots lobbying is a communication to the public. And that includes everything from tweets to ads to big speeches and newsletters that you send out. So it's a communication to the public on specific legislation that reflects the organization's viewpoint on that legislation. And it includes a call to action. And clearly this is what differentiates a grassroots lobbying communication from the definition of direct lobbying. Under direct lobbying, any communication with a legislator about specific legislation that reflected a viewpoint, any of those communications would be lobbying. In the public communication world, it's grassroots lobbying only if you also include a call to action. So a communication to the public on specific legislation that reflects the organization's viewpoint but does not include a call to action. If you omit that call to action, then it's not going to be lobbying. And so we can do a whole lot of different kinds of activities if we simply omit that call to action. So what is a call to action? Most commonly, it's asking the audience to contact their legislator, saying, call Senator McCaskill and ask her to vote yes on S297 or what have you. Here's an example of a ad of a flyer from Kansas recently where it said, call your legislator at 866-519-2200 and tell them to vote no. So that's a very clear call to action. And if that's all it were, it'd be easy for us to circumvent the IRS rules because we could come up with all sorts of ways to create calls to action that didn't include those specific words. So the IRS says other forms of communication can also constitute a call to action, identifying the audience's representative, providing their contact information, or identifying that legislator as neutral or opposed to your position on the legislation. And the reason the IRS has identified these is that by taking any of these and putting any of these into your communication, it gives just enough of a push to the audience to make them think, hey, I should pick up the phone and give that person a call. Hey, I should send an email to that legislator. If you say, Senator Frick is your local state senator, or if you say, Senator McCaskill is on the fence. If that billboard on I-70 said, Senator McCaskill is on the fence and hasn't decided whether to vote for S297 to protect Missouri's children. By identifying the legislature as neutral or opposed, the audience is likely to want to pick up the phone and call them. If you say, thanks for voting or thanks for supporting S297, Senator McCaskill, no one driving by is going to think that they need to pick up their phone and contact Senator McCaskill to encourage her to support the legislation because she already does. But identifying a legislator as being neutral or opposed does count as being a call to action under the IRS rules. Similarly, if you provide a petition or any kind of other vehicle for contacting the legislator, that counts as being a call to action, or identifying the legislator as being a member of the committee that will vote on the legislation. So if you put out a report that talks about a piece of legislation and talks about why it will be helpful or harmful to your community, and then you name the members of the subcommittee that are going to be voting on that legislation, that counts as grassroots lobbying. There's one other minor exception if your issue becomes so highly publicized that it's running as the lead story on the news or it's frequently on the front of the newspaper and you're doing paid advertising. Because so few of these organizations, because so few of your organizations do paid advertising, we won't get into the details of it, but just keep it in the back of your mind if you do any paid advertising. One other issue to consider is, in addition to the direct communications that you're having, the reports that you're writing, the meetings that you're having with your legislators, there's another category of activity that counts as a lobbying cost. And that would be activities whose only purpose is to prepare for lobbying. So if you're having an activity, the only purpose of the activity is for lobbying, then the time you spend on that activity must be reported as a lobbying cost. And it can't be paid for with funds from the Health Impact Project. So for example, producing a fact sheet that's only going to be used for lobbying would be considered a lobbying cost. If you produce a report, and that report is primarily going to be used for lobbying, then all of the staff time that went into writing that report, all of the staff time for researching and designing the report, all of those costs need to be paid for with lobbying funds, and they can't be paid for using Health Impact Project funds or other restricted grant funds. So the way to determine whether an activity is in preparation for lobbying is to look at the time frame of when the activity, when the result of that activity might have been used for lobbying. So for example, if you produce a report and it's used for lobbying any time within the first 6 months after you've produced that report, the IRS is going to presume that you created that report for a lobbying purpose. And in order to rebut that presumption, in order to convince the IRS that you created that report purely for educational purposes, and therefore that you could use restricted grant funds for it, you have to demonstrate that the primary purpose of the report was for non-lobbying purposes. You can rebut that presumption by explaining that you used the report for non-lobbying purposes. The reason the IRS has this 6-month window is that the IRS assumes that if you create a report and you don't use it for any lobbying until far down into the future, you didn't plan ahead to create that report just for lobbying. You must have created that report for some other purpose, and they will assume that your lobbying was merely incidental. So for example, if you release a report in January and you don't use it for lobbying at all until September, then there's no risk that the cost of creating that report would be viewed as being a lobbying cost. However, if you release that report in January and then people use that report for lobbying in March, when the State House comes in session, when the legislature is in session in March, the IRS is going to presume that all of the expenses related to that report are lobbying costs, unless you can demonstrate that between the report release date and the time it was used for lobbying, unless you can demonstrate that during that time period, you used that report as public education for the most part, and that the lobbying use in March was very small in comparison to all of the public education that occurred between January and March. Now, I assume that many of you on the phone are thinking to yourselves, well, we never use our health impact assessments for lobbying. And that may be the case, but it may also be the case that your coalition allies bring those health impact assessments to legislators and give those health impact assessments to legislators when they go on their lobbying visits on issues that are covered by the HIA. It's also very possible that your HIA does reflect a view on legislation and that you have conversations with lobbyists about, that you do have conversations with legislators about your health impact assessment. Very frequently, I'll have clients who get calls from legislators because they know that the public health organization is the expert on that issue. And the legislator will call them and say, I read that you did a report on X issue that I'm planning on having legislation about. Can you help me shape my bill? Can you help me shape my legislation? And that conversation would be a lobbying conversation. So getting back to as part of this subsequent use rule, the way to demonstrate that you used the report for non-lobbying purposes between January and the time it was used in March is to demonstrate broad public distribution of your reports. So that's why it's so important that you get your reports out to coalition members, that they and your organization post on Facebook and send tweets about the organization to build a drumbeat about your report, that you put out news releases and you give copies of an HIA to editorial page editors or key bloggers, or that you think about trying to get on talk radio to talk about what your HIA has said about the issue that you're studying. All of these issues, all of the ways that you are trying to reach out and share your HIA with the public, whether that's academics, other public health experts, inside and outside of government, at the executive agencies, physicians organizations, and the rest. Those are all ways that you can demonstrate that between the report release date and the time it was used for lobbying, you can demonstrate that during that time period, you did a really broad public distribution, and the IRS should not presume that the report was created primarily for lobbying. There's two other exceptions that are especially pertinent for groups that are doing HIAs. And the first one is for nonpartisan analysis, study, and research. And a report that qualifies for this exception for nonpartisan analysis, study, and research, a report that qualifies for this is not lobbying, even if you provide it to legislators. The report has to be independent, providing an objective analysis of the issues. And you have to distribute it broadly to all sides of the issue, all sides of the political landscape. And it can advocate for a viewpoint, but it needs to include a full and fair examination of all aspects of the issue. Now, that means, for example, that a reasonable person could read an HIA on seatbelt use, for example, and a reasonable person could come to the conclusion, well, there are certainly pros and cons in this report, and I understand that the report writer thinks that seatbelt usage is worthwhile, but I see the opposing sides outlined here in the report, and I'm going to come to a opposite conclusion than the report is advocating. The HIAs that you all work on are very robust, but that doesn't necessarily mean that it qualifies for the nonpartisan analysis, study, and research exception. You need to have data on all of the key questions that are relevant to the issue so that the reasonable reader can form an independent conclusion. You can't leave out data that doesn't support the side that you are going to land down on. And we can talk about this exception a little bit more as we get into the Q&A section of our discussion. The last exception that I wanted to discuss is for technical advice or assistance. And this is oral or written testimony that's provided in response to a written request by a governmental body or legislative committee. Now, the request has to be made in the name of the entity and not just come from an individual member. So, for example, in the example that I'm showing on the screen right here, the example here, the request is coming from the chair of the committee on Transportation and Public Safety, which is part of the Senate Finance Committee in Minnesota. And it's asking on behalf of the entire committee, not just on behalf of the state senator who's the chair of that committee. It's important that the letter be addressed from the entire committee. So in order to receive a technical advice or assistance letter like this, you need to be on reasonably friendly terms with the committee chair. It can't just be that a member of the minority or some backbencher who sits on that committee invites you to testify or invites you to give written advice to the committee. It needs to be coming from the chair. And the reason for that is the IRS wants to be able to demonstrate that there's a strong desire and demand by the governmental body to have you testify, to have you share your expertise. It doesn't want this exception to be abused by backbenchers inviting anyone who will support their particular point of view. The advice that you're sharing needs to be made available to all members of the requesting entity. It can't just be given to one side or the other. It needs to be given to everyone who sits on that committee. And it may advocate a viewpoint. It may advocate very aggressively why a particular piece of legislation is good or bad, as long as the request specifically asks for or seeks opinions and recommendations. So this is a very powerful get-out-of-jail-free card, and it's great when organizations take advantage of this technical advice and assistance get-out-of-jail-free card. However, it's very important to talk to your lawyer as you're trying to get one of these letters, because the IRS has some very specific language that they want in a particular way they want these requests framed. For example, on this letter from Minnesota here, the way that we worked that out was the advocates at the Heart Association and the state senator in this case had talked about having the advocates come and testify. Then the advocates spoke to me about what exactly would be needed in order to use non-lobbying funds for the time testifying and for the time spent developing that testimony. And so I wrote up a letter that complied with the IRS requirements. We sent it over to the state senator's staff. They drafted up this letter and they sent it back to the Heart Association so that the Heart Association could have adequate documentation that they could provide to the IRS to explain why the testimony on that day qualified for this exception. And as you all know, testifying, preparing testimony, writing testimony, and researching it is a very time-intensive activity, so it's important that you don't have to spend lobbying dollars, that you can use your restricted grant funding to do that whenever possible. So now we'd like to transfer to our section of questions and answers. We have a chat box available. If anyone wants to type in any questions about the activities and the information that I've already covered, we'd welcome any questions that people have. And then we also want to talk through a couple of hypothetical situations so that we can address any sort of real-world situations that Health Impact Project grantees have. So the first question we have is whether the technical...
Your microphone has been turned on. Your microphone has been turned on.
The technical advice or assistance exception works at all levels of government. So you could use that at the city and county legislative bodies as well, and it's very powerful. And then one other question is whether learning more about the issue of when does something reflect a view on legislation. So going back to the key definition of direct lobbying and also grassroots lobbying, recall it's a communication with a legislator or staff member on specific legislation and that reflects a view on that legislation. The IRS has not defined specifically what reflects a view on the legislation. They leave that as a pretty open-ended and broad description. Anything can reflect a view on legislation. It doesn't have to necessarily say that the legislation is good or bad. It doesn't have to endorse the legislation. A communication that merely talks about what the impact of that legislation will be, what the effects, in your case, is what the health impact will be, what the health effects will be, what will the outcomes be on economics. That all can reflect a view on the legislation. It doesn't have to be something that says this legislation will harm people in Minnesota. It just, simply saying this legislation will provide greater access to health insurance, which will have a salutary effect on their health, or it will enable people to get preventative care, which will mean fewer emergency room visits, which will ease the burden on the healthcare system. Those all reflect a view on legislation. Really, the only thing that would be neutral about legislation is a fact sheet that simply explained what it does. If you have a fact sheet about legislation that says this legislation will raise the speed limit on highways from 55 miles an hour to 65 miles an hour, provided that that highway has an adequate median and adequate shoulders to provide, a 6-foot buffer or whatever it may be, those very specific technical details of the bill would not reflect a view on what the bill does. But if you talked about that the bill is estimated to cost 23,000 lives over the course of 10 years because of higher traffic accident rates, that would reflect a view on the legislation. One other question is, we engage residents through organizing, and if our resident leaders spoke to their neighbors about a certain ballot measure or expressed their position, would that count as our organization's lobbying, whether it's intentional or coincidental? Mark, can you give a little bit more information about what you're thinking on that? Explain a little bit more what you're saying. You could just speak up. Your microphone should be unmuted. Doesn't sound like we can hear Mark. So the issue here is, as I understand it, if an organization does grassroots organizing and encourages people to speak to their neighbors about a ballot measure, if your job is to encourage people to engage with the public, and you're encouraging those people to communicate with their neighbors about a ballot measure, then you're encouraging them to contact, in the case of a ballot measure, you're encouraging them to contact the legislators, which is a call to action. If, however, your job is simply to, there's a ballot measure going on and people are contacting their neighbors about the ballot measure, and that's not part of what the organization is engaged with, that might not be lobbying. So that's a sort of it sounds like a very specific situation where the specific facts and circumstances would really impact what the outcome is in that situation. Let's see. Tatiana, for some reason, here we go. So we'll talk through a couple of hypotheticals, and then we'll get to some more questions. So let's say that let's say that Missouri has a plan for public transit project, which will require a large amount of state funding, and your organization drafts an HIA analyzing the project. Senator Smith, who sits on the Senate Appropriations Committee, calls to discuss implications for her pending budget proposal that would fund this public transit project. Is it lobbying to discuss how her plan will impact local health when she gives a call? Does anyone want to take a stab? Does anyone want to jump on the phone to try to answer this one? We have Greg, who says it's not lobbying to discuss how her plan will impact local health. Greg, do you have access to a phone? Do you want to explain your reasoning behind that? Does anyone else with a phone want to take a stab at it? Okay.
Sure. Sure. This is Jonathan Heller.
Hi, Jonathan.
Hi. I would say it depends on whether it's a full and fair exposition of the facts, and if you're looking at both sides, positive and negative impacts, and if you are discussing both sides, then it's not lobbying.
That's okay. I can understand. So Jonathan's saying that applying the nonpartisan analysis, study, and research exception, it would not be lobbying as long as you give a full and fair exposition of the facts on either side of the issue. The nonpartisan analysis, study, and research exception applies only to essentially to written reports and to written research. There's not enough. You're not able to give enough, a robust examination in a phone call or a meeting. The IRS won't view that as being nonpartisan analysis, study, and research. That exception is really reserved and limited for reports that you might write, a multi-series documentary that you might engage in. I'm glad you raised that though, because I'm glad I was able to. I'm sorry I didn't make that more clear earlier. technical advice or assistance is really a very limited exception that may apply to your reports and may apply to your HIAs. I'd urge everyone to have your lawyer review the HIA to make sure that it really does qualify for that exception if you're using it to say that your HIA is not a lobbying expense. In this case with Senator Smith, it would be lobbying because it would be a communication directly with a legislator reflecting a view on legislation if you're talking about how the legislation will impact local health. If Senator Smith, well, let's get into another hypothetical that should explain the next where I'm going with this. So let's say Senator Smith asks you to testify at an upcoming hearing about how the transit plan will impact local health. Does anyone want to take a stab at this one? We have a few people who are typing in answers. We have a bunch of votes here for not lobbying if Senator Smith asks you to testify, and Max says if it's a written request, exactly Max, if it's a written request on behalf of the entire committee, for example, if Senator Smith were the committee chair, if it were a written request on behalf of the entire committee, it would not be lobbying. But if it's just Senator Smith asking you to testify because she's the bill sponsor or because she has a particular interest in it and is not the committee chair, then it would be lobbying to testify at that upcoming hearing. Because when you testify, you're having a direct communication with legislators about specific legislation. And if you're talking about how it will impact local health, then that testimony is going to reflect a view on the legislation. Do we have any questions about that one? Because I have a feeling that that's one that's probably may cause some consternation among folks.
Can I ask a question verbally?
Sure.
What if you get this request and you also submit a written report to the full committee that does that fair and full exposition of the facts?
If you're asked to testify, so the situation would be, if you're asked to testify just by a member of the committee, not by the committee as a whole, and so it doesn't qualify for the technical advice and assistance, then your testimony would be lobbying, because even though essentially you might be providing a summary of the executive, maybe there's an executive summary, and you would just be, summarizing that in your testimony or reading the executive summary in your testimony, you're still not providing a sufficiently full exposition of the facts to qualify for the nonpartisan analysis, study, and research exception. Essentially, unless if you read the entire report, then you could perhaps qualify, but nobody, they're going to cut you off. They're not going to let you read the whole report. But you could submit that report. If there's a hearing, you could certainly submit your HIA as a written response. And that could qualify as, that would not be lobbying because it would qualify under the nonpartisan analysis, study, and research exception. So the nonpartisan analysis, study, and research exception is really used for when you provide your reports to members of the legislature. That's a way to get that to qualify, but you're not going to be able to testify as a summary to that. Similarly, though, if you're doing a report, before as soon as your report comes out, you should be distributing it, as we talked about, in the broad public dissemination when we went through the examples here of broad public dissemination. That will also help, even if your report doesn't qualify as nonpartisan study, analysis, and research, even if it takes a more lopsided view of things. As long as you have this broad public dissemination prior to using the report and giving the report to any legislators, if you have the broad public dissemination, giving the report to the legislators will not count as lobbying down the line. We have a question here two questions. One from Tatiana. Does it make a difference if you testify as a neutral? Now, in some states, the state law says that when you testify, you say, I'm in support of the bill, I'm against the bill, or I'm neutral on the bill. And for state law purposes, that may satisfy the state law of whether or not you have to register for state lobbying reports. But for the IRS, simply saying that you're neutral on the bill, but still reflecting a view on the legislation, for example, talking about what the impacts of the legislation will be, would actually be lobbying under the IRS rules. We have a second question here. If the organization does an HIA and they want to use the findings for lobbying using other funds, not health impact project funds, the most important thing for us to do is to do sufficient non-lobbying communication so the grant-funded activity is not seen as preparation for lobbying. Is that correct? Yes. So it's a two-part answer. The first step is even if you don't have any lobbying funds, as long as you do a sufficient non-lobbying public dissemination, you're still able to provide that report to legislators. And the report costs, i.e. the cost of writing and designing and researching the report, none of those costs will count as lobbying. However, maybe you want to do a bunch of sit-down meetings with key legislators who need to be educated about what the impact will be of this legislation. And you have some non-lobbying funds. In addition to the Health Impact Project grant, you have other funds that you're allowed to use for lobbying. So you could bring that report in after you've already done your broad public dissemination. You could bring that report into a meeting with a legislator, hand the report to the legislator, not lobbying for the report. That won't turn the report into a lobbying communication. And then you could spend an hour or two talking to the legislator about why the bill will help or harm the health of people in your state. You'll need to charge the time of that meeting as a lobbying expense, and whatever additional preparation time of your lobbying, the preparation time to get ready for that meeting would also need to be charged as a lobbying expense. But you'll already have spent so much time getting up to speed on the issues because you're already an expert on the issues having written the HIA that it won't require a very significant outlay of lobbying dollars to go and meet with some legislators. So that gives you a way of sort of maximizing your lobbying funding and stretching your non-lobbying dollars farther. So we have another question. This is a question about when does a plan rise to the level of legislation? And there's a very complicated situation here by the County Transportation Commission. And rather than trying to address the exact specifics of that specific plan, there's a bit of a gray area between when a plan becomes specific legislative proposal. Essentially, when you are attaching dollar figures and enough specificity to the plan so that a legislator could essentially write legislation to implement it, that's essentially the line the IRS is looking at. There is a gray area in between where you're just talking generally about policy and when you are discussing a particular plan. For example, if you're talking about the need for a community to reduce consumption of sugar-sweetened beverages, that would just be policy discussion. When you get to this level of discussing that the state should implement a 2-cent per ounce tax on sugar-sweetened beverages, that would be closer. That would be more of a specific legislative proposal. But in most of these cases, they are sort of things where you need to talk through with your lawyer to see if, okay, we have a situation with the County Transportation Committee. Do you think we're at a point right now of which side of the line are we on at this point? So on this question, this is pretty similar to the prior one. reason I raised this one is getting back into the issue of if you have a health impact assessment that qualifies as nonpartisan study analysis and research, the report itself would qualify as non-lobbying, but if a legislator's chief of staff asked you to provide talking points summarizing the findings, you'd have to spend lobbying dollars to write up those talking points. You'd have to find funding outside of the health impact project to provide that chief of staff with the materials that he or she is looking for. I'll answer a question before we get into this environmental issue. Question here from Sheila is, several steering committee members are actively engaged in lobbying on issues related to the focus of our HIA. Are there special measures we should take to make sure their activities are separate from our HIA? That's an excellent question, and that's one that comes up very frequently. The key issue here is whether if the folks who are on your steering committee are going to be using your HIA in their lobbying activities, then you need to demonstrate that you had a broad public distribution of that HIA before those folks go off and do lobbying with it. If those members of the steering committee were involved with recommending that you create the HIA, or if they were involved with that HIA. Now, what happens frequently are situations where you're in a coalition with other advocacy organizations on your issue, but you haven't coordinated with them on your HIA. You produce an HIA about a given issue, you distribute it out to members of your coalition, and then those coalition members go and lobby using your HIA. And I often get questions from academics who say, look, I wrote this great paper, I wrote this report, and other people used it for lobbying. Am I going to get in trouble for that? And the answer is you won't get in trouble for that as long as you didn't work in conjunction with those folks to create materials for their lobbying activities. So if they find good materials because you're in a coalition with them and they decide to run with those and use them for lobbying, that's not going to turn your time into a lobbying cost. But if you collaborated with them and they said, hey, we need some background material to explain why this bill is so bad, can you do an HIA? Or can you make sure that the HIA comes out in time for us to lobby with it? Then those costs could be viewed as lobbying costs, and you just need to demonstrate that you had that broad public dissemination before any of those steering committee members went off and used your plan for lobbying. So as long as you're getting that broad public distribution out, you can't control what the people who receive it are going to do with it. And you won't be held liable for what the folks who receive the report do with it unless you've coordinated ahead of time. So let's talk about this hypothetical public transit HIA. So a local environmental organization provides the executive summary from your HIA when they meet legislators to lobby for a public transit project. Pretty much exactly what Sheila just asked. So I'm not going to beat a dead horse with it. But this is the same sort of thing that came up with the steering committee of if you coordinated with them, then you need to be able to demonstrate that you had a broad public dissemination before they used it for lobbying. Otherwise, that coordination could make your HIA a lobbying activity. But if they just took the executive summary and ran with it, unbeknownst to you, then you're not going to be held liable for that. So we have let's have another hypothetical about this public transit HIA. Let's say the city zoning commission chair asks for your help in writing a new zoning restriction to focus development around the transit project in a way that's going to benefit the community. Would working with the zoning commission chair be lobbying in this situation? We have a couple of votes for yes here. And we have a couple of votes for yes and a couple for no. And the interesting, so I want to address Sharon's issue, which is a very astute observation. So Sharon said that if they're not an elected official, then it wouldn't be lobbying. And what I want to call attention to is that the definition of direct lobbying, and I'll jump back to there. Let's jump back there. It's a communication with a legislator or their staff member. And the way the IRS defines legislative body doesn't depend on whether or not you're elected to it. There are a lot of elected school boards and elected zoning boards, and the IRS just views school boards and zoning boards as essentially being similar to administrative agencies, that they're not creating legislation, that rather what they're doing is implementing as a regulatory body, implementing government decisions. So the communication here with the zoning board chair, even though you'd be talking about with an elected official about something that their government body is going to do, it wouldn't be lobbying. It wouldn't be lobbying because they don't count as a legislative body. So it's important to think through as you're trying to influence public policy. Remember that if you talk to folks at regulatory agencies, zoning boards, outside of government, folks at big corporate and institutional actors, universities, they can all play a really important role in promoting public health, but they don't count as lobbying if you're communicating with them, unless you have a call to action, unless you're asking them to contact their legislator or contact a key legislative official about the about your HIA or about that issue. So here's one that looks a little bit complicated, but the issue here is that a community is considering a tax on sugar-sweetened beverages, and your organization writes a report, writes an HIA that notes that the reduced consumption of sugar-sweetened beverages will cause losses of jobs in the beverage and bottle manufacturing industry. And you note that, but you say, look, there's not enough data to exist to analyze the impacts that this will cause on health, on state tax revenue, on Medicare claims. If you distribute the health impact assessment to legislators, would it qualify for the nonpartisan analysis, study, and research exception? And I hope that, I think that as I read it, it's pretty clear that the way I've written this answers the question. You wouldn't be nonpartisan analysis, study, and research if you say, we don't have enough data to analyze these impacts, but we're going to provide a lot of data that show the positive impacts of the bill. Essentially, in this sugar-sweetened beverage example, you'd have a relatively lopsided analysis where you recognize that there are arguments in favor of, arguments against, in this case, arguments against the tax because they would hurt jobs, but you're not analyzing those in your health impact assessment. So it's important that we analyze all of these things, and keep in mind as you're doing your HIAs how it is, if you're trying to satisfy that nonpartisan study, analysis, and research, how important it is to really give a robust analysis that a reasonable person could read and say, you know what, they make a lot of good points on their side, but I disagree with them. I'm going to come down on the other side. And so for our last hypothetical, I want to throw it open to a little bit of discussion and find out if you don't have enough of an even-handed analysis to qualify for that exception, what steps could be taken to ensure that you can provide it to legislators? Anyone want to jump on and share their thoughts? And we have a bunch of comments saying broad public dissemination. And exactly. By disseminating it out in a whole bunch of forums, by doing essentially your grassroots organizing and your communications outreach, even if your HIA is lopsided, if you get it out to the public before you use it for lobbying, you're going to protect yourself, and you'll protect those costs to ensure that even if there is incidental lobbying with that report, then you will have protected the costs from being viewed as lobbying costs. I mean, essentially, it's, like any other advocacy publication, you're demonstrating, you're coming down on one side of an issue, but you're getting it out broadly so that people can use that, for an incidental lobbying expense later on down the line. Are there any other questions? I understand we're coming up at the end of an hour, and I appreciate everyone taking your time. I know that this is very dense material, and KHI Kansas Health Institute will be posting this on their website, and will be making the slides available. I don't know if Tatiana, if she's going to email them out as well, but I would hope that she will, and I'll provide a cheat sheet also for a reminder of what are the prongs of the lobbying and non-lobbying definitions.
Alan, thank you so much. This is Tatiana. I really appreciate you going into a very deep overview of all the slides, all this information. As you mentioned, it will be available on the KHI website. I will send an email with the information how to access this presentation, as well as we'll try to summarize your questions and provide additional slides with Q&A that we had an opportunity to discuss today. So you'll have access to this information as well. And Matt and Alan, I also have a question. If there are any follow-up questions, what would be the appropriate form for you to take those questions?
I'd be happy for people to send me an email, or they can go do it through you, whichever you'd prefer, Tatiana.
Well, maybe we will discuss that also with Health Impact Project and figure out the best streamlined way to get those questions to you. And so we'll have this communication to you by the end of the week, so you would know what our next steps are and how we will proceed with this information.
And as everyone is processing and thinking through the stuff that we discussed today, please do ask any other additional questions you might have.
Well, thank you so much for your attention today, and really appreciate your time. Thanks, and have a great week.
Thanks, everyone. Bye-bye.